I have my clean gloves and my dressing change package, my wound with the bandage already applied, and my biohazard waste bag. I will begin by collecting my supplies. When I enter my patient's room, I will close the door to ensure patient privacy. I will then place my supplies on a clean, dry, flat surface area at an appropriate height. I will then perform hand hygiene, introduce myself to my patient, verify my patient, and explain the procedure. Hello, my name is Bessie. May I see your wristband? Can you confirm your name and date of birth? Thank you, Miss Jane Doe. I'm going to be removing your current bandage, cleaning your wound, inspecting it, and applying a new sterile bandage. It's important that you do not touch your wound or the sterile supplies during the procedure. Do you have any questions? Okay, we'll begin. I will start by performing hand hygiene, applying my clean gloves, I can then remove the bandage starting from the outside, pulling towards the wound on each edge, making sure I pull the bandage parallel to the wound and disposing of the bandage appropriately. I can then remove my gloves, dispose of them appropriately. I will then perform hand hygiene, open my sterile package. I'll start by grabbing my sterile gloves. I see that the arrow is pointing down. I'll make sure it points down towards me, making sure the sterile gloving is on the clean, dry surface area, putting my fingers under the 1-inch barrier to pull outward, making sure I don't touch the inside of the 1-inch barrier. I will then use my 2 fingers on my non-dominant hand to grab the inside of the cuff of the first glove and applying it to my dominant hand, making sure that the outside of the glove does not roll or touch my hand or any of my skin around the glove, using the fingers of my gloved hand to go under the cuff of the second glove to apply it, making sure that it doesn't roll. So this will be my unsterile hand where I will clean the wound. This will be my sterile hand where I will grab sterile supplies. Please note that I only have 1 sterile gauze and 1 ChloraPrep, and I will be using them as if I have multiple tools. I will first grab the ChloraPrep, drop it into my hand, activate it, clean the inside of the wound, discard of this ChloraPrep, grab my second ChloraPrep, drop it into my hand, activating it, cleaning the outside of the wound, peri-wound, discarding this ChloraPrep, grabbing the sterile gauze, dropping it into my hand, using it to dab dry, starting with the inside of the wound, disposing of this gauze, grabbing my second sterile gauze, dropping it into my hand, and dabbing dry the outside of the wound, and then disposing of this gauze. I will now be able to palpate and check the wound, checking for any color change, skin type such as granular, checking for any signs of infection, odor, or discharge. I will then be able to measure it if required. I can now apply the new sterile taxiderm dressing. Please note this has been opened and used due to practicing. So the white border is not on this package, but I will continue as if it was. Dispose of the wrapper. Remove the backing and applying the taxiderm to the wound. I will then remove the white border and dispose of it. I can now gather the rest of my supplies. And dispose of them appropriately. I can now remove my sterile gloves, making sure it doesn't roll or touch my skin. Dispose of that appropriately. I will now initial date and time with a permanent marker over the taxiderm bandage. Perform hand hygiene. Make sure my patient is in a comfortable position, ensuring that the call light is close by within reach, closing the door upon my exit to ensure patient privacy. Then I will document the procedure.